Welcome to Wellness Wednesdays, a web series where we examine how COVID-19 has impacted our healthcare system and what you need to know as you re-engage with your physician and get the healthcare you and your family needs in 2022.
Today on Wellness Wednesday, we'll be talking about skin cancers. We know that most skin cancers are caused by UV exposure. With summer right around the corner, this is the perfect time to talk about early detection and prevention. Unfortunately, skin cancer is the most common type of cancer worldwide. 1 in 5 adults are going to be affected by a skin cancer by the time they are 70. The good news is 99% of skin cancers are treatable if caught early, but early detection is the key. Performing full body skin checks once a month is going to help find lesions early so that they can be treated. The best way to do this is by looking at sun-exposed areas and looking for any lesions that are changing or growing with time. Especially if a lesion is bleeding or itching, this should probably be looked at by a professional. We know that most skin cancers are caused by exposure to UV light. So to lower your risk of skin cancer, decreasing your exposure to sunlight is going to help. The best way to do this is to stay indoors during the hours of 10 a.m. to 2 p.m. when the sun's rays are the brightest. If you do need to be outside, wearing UV protective clothing or wide-brim hats is going to decrease your risk as well. If there are still sun-exposed areas, using a sunscreen with an SPF greater than 30 is going to be recommended. One of the myths out there is that going to a tanning bed prior to going out in the sun will help get a baseline tan to help prevent future burns. However, this is untrue. Even one round of tanning in a tanning bed will increase your risk of melanoma by 20%. Another myth is that melanoma appears only in a pre-existing mole. Unfortunately, this is untrue as well. Melanomas can appear as a new bruise or even discoloration or pigmentation under a nail bed. When checking for any skin cancers, it's important to remember the ABCDEs of melanoma. The A stands for asymmetry, or any lesion that is not the same on one side as it is on the other. The B stands for border, or how the edge of the lesion looks. If it is irregular, that is going to be more concerning for a melanoma. C stands for color. A lot of times people think that melanomas are always black, but many times melanomas can appear black or brown or blue and have many different colors within the same lesion. D stands for diameter. Any lesion that is greater than 6 millimeters or approximately the size of a pencil eraser is going to be more concerning than a smaller lesion. E stands for evolving. Any skin lesion that is growing, itching, bleeding, or changing color over time needs to be examined. The good news about skin cancer is that 99% of skin cancers are treatable if caught early. If you find a lesion that you are concerned about, make an appointment with your provider immediately. If you need more information, you can check our website at utmedicalcenter.org.